Coverage of the 26th annual meeting of the ASMBS is sponsored by Allergan, makers of the lap band AP system.
Hi, this is Leslie Thompson for the Weight Loss Surgery Channel at the 2009 annual meeting of the ASMBS, and I'm here with Joe Naglowski, president of the OAC, the Obesity Action Coalition. Joe, thank you so much for joining us.
My pleasure to be here.
First, for our viewers, some people, believe it or not, don't know yet what the OAC is. If you could tell us a little bit about your mission and your purpose, a little bit of the history of the organization.
The Obesity Action Coalition is about a 4-year-old nonprofit organization that was formed after a legislator stood up and said he had never heard from an individual affected by obesity asking for help. And we realized at that point that there really wasn't a unified voice of those who are struggling with their weight, working on behalf of others struggling with their weight to try to address obesity in this country. And so with that, the OAC was born with the mission to educate and advocate on behalf of those affected by obesity and morbid obesity.
Well, it's interesting that a legislator was the one who sort of spurned the idea for the organization, because you're very active in legislation regarding the treatment of obesity. And I know that you had a couple of recent wins, Mississippi and Texas. Can you catch us up on that?
Sure. Mississippi was a great case. A legislator in Mississippi who happens to be a bariatric surgery patient himself stood up and said, you know what, our state employees don't have access to obesity treatments, including bariatric surgery, and introduced a piece of legislation that would require the state to offer to their state employees such treatments. And after a bit of a lengthy debate, the legislation did pass this year, and so starting next year, Mississippi state employees will have access to obesity treatments across the spectrum, including testing a bariatric surgery coverage program, which will allow about 100 employees per year for the next 2 years to access bariatric surgery.
Excellent.
And then here in Texas, where we're based today, the governor just this week signed legislation that will add a bariatric surgery benefit to the state employee fund here as well. We're still waiting on the final details of what that benefit will look like. The bill was a little bit vague, but it did require that a benefit be implemented. Our only concern, of course, is that it will be implemented with guidelines or copays that are too strict or too high, and so we're closely monitoring that going forward in the future. And in fact, when we talk about legislation at the state level, it really is a never-ending process. Just because we get legislation passed, we have to continue monitoring it throughout the years to make sure that the benefit isn't just created, but people can't access that created benefit. And so that's now our goal here in Mississippi and Texas. And now there are only, I believe, 7 states across the United States that don't offer bariatric surgery coverage for their state employees. So the vast majority of our government employees have access to bariatric surgery.
Excellent. What other legislative initiatives are kind of coming down the pike?
I think the main thing that's coming up now is the debate around health care reform. This summer that definitely will heat up. It is the big issue in Washington, D.C. There are many opportunities with health care reform, from its focus on prevention and wellness to its talk of providing coverage to a wider range of treatment options. Of course, there are also threats with that. We are looking at the possibility of a very expensive bill for health care reform, and we wouldn't want obesity treatments to be left off of that bill. So we're working very, very hard to educate our federal legislators and encourage all of your viewers to do the same, to reach out to their elected officials and say, you know, addressing obesity as part of health care reform is very important. And it simply takes an email or a phone call, and all of that information on how to do that can be found on the Obesity Action Coalition's website at obesityaction.org.
Fantastic. We will definitely encourage our viewers to be a part of that push, because, like you said, that is imperative. Now, tell me about the Footprints initiative that you're doing.
Our concept behind the Make the Footprint campaign is that the time for symbolic action is behind us. It really now is the time. It is a once-in-a-lifetime opportunity when it comes to healthcare reform to really make a difference, to really put a stamp on this issue. And so we are encouraging everyone to make their footprint, make a difference, write their legislator, join the OAC, become part of the process to give access to everyone who needs it for their treatment of obesity.
And another way people can make a footprint is to participate in the Walk From Obesity. Tell us a little bit about that.
The Walk From Obesity is a national fundraiser and public awareness event that's existed now for 7 years. The majority of them happen in September and October of every year, so it's coming up relatively soon. There are walks in cities all across the United States, usually 60 to 70 cities. And so if you want to find out if there's a walk in a city near you, visit www.walkfromobesity.com. The proceeds of the walk benefit both the educational and advocacy missions of the Obesity Action Coalition and the research initiatives of the ASMBS's charitable foundation.
Oh, fantastic. Well, we will definitely include those calendar dates as well on the Weight Loss Surgery channel.
Appreciate that.
Now, obviously, we share the same mission in terms of educating and informing people, both pre- and post-operative bariatric patients and their family and friends about treatments for obesity and new legislation, new healthcare initiatives. How do you see the Weight Loss Surgery channel supporting your efforts and supporting the community as a whole?
I think it's a great partnership, because as we look forward, it really takes a combination of education and advocacy. We need people to be well educated to be advocates. We need more people to hear the need for advocacy, and so we really appreciate the fact that we're able to come and talk to you today about the programs and services that we offer, and hopefully together we can help improve access to the treatments of obesity and make the lives of those struggling with obesity better.
Excellent, and we appreciate all of the hard work that you're doing, truly and sincerely. So, Joe, thank you so much for your time.
Thanks for having me.
Thanks for joining us. And thank you for joining us today. I'm Leslie Thompson for the Weight Loss Surgery channel.